Okay, so this is Dr. Ayman El-Hattab. I'm a consultant in clinical genetics, and I'm the director of the Genetics and Rare Disease Center in Burj Medical City in Abu Dhabi. And I'm also the president of the MENA Congress for Rare Diseases and MENA Organization for Rare Diseases.
Thank you, Professor Ayman, for coming. And first question will be, what do you think, what are the most difficult challenges which we are facing now in the area of rare diseases?
Okay, so we still have many challenges to overcome. Like if we start from patient identification, we don't have like a proper registries to tell us about patients and the load of the effect of their disease. Second thing, as we all know, most of rare diseases, they don't have a specific treatment, and we only depend on symptomatic treatment. We have the challenges in making the diagnosis, as we don't have, in many places, we don't have the laboratories, which is mainly like we need genetic testing. And one more thing is, even for the small percentage of conditions where when we have a disease, when we have a treatment, these treatments are very expensive and many times not reimbursed by insurance or other systems. So these are like really the main points that we are working on, and see how we can find solutions and provide better care for these individuals.
Mm-hmm. Thank you, Professor Ayman. And you have rich experience in international collaboration, because you are leading MENA rare disease. And what do you think, what are the potential, the most interesting and demanded areas in international collaboration between UAE and BRICS and CIS countries? So what could be done together?
Yes, the collaboration starts with the clinical trials. Now, if we have a clinical trials, the patients sometimes need to travel to different countries too. So we have really a strong encouragement to bring clinical trials to the UAE and other countries. So by this, we get like more patients to participate, and without the need to travel abroad. So clinical trials is something that we focus on, and currently at Burj Medical City there are several clinical trials that are conducted in this institution. Now there is more focus on bringing clinical trials related to rare diseases. But this is not only it, but also like when we finish the trial and we need to get approvals and distribute the drugs, also it is encouraged also by the government sector and private sector to participate in manufacturing medication. And I think there are like several trials now to start manufacturing these treatments in the UAE and other countries in the region.
Professor Ayman, and also regarding your genetic rare disease center in Burj Medical City, what do you think? What is the role of such kind of centers? Are they needed in each country? And so what are the main functions which you see in those centers?
Yeah, thank you very much. Yes, they are needed. They are needed in each country. And when we established the center, we put in our mind three main missions for this center. One is to provide a clinical care from diagnosis and treatment and novel therapies. And this is what we are doing. Second is to participate in clinical trials. As I explained, this will help and help everyone in really reaching more treatment in shorter period of time. And the third part, I mean, I should have mentioned that, and the challenge is a lack of awareness, lack of knowledge about rare diseases. So we have a unit, we call it Social Integration and Education Unit. So this unit is responsible to make conferences, spread awareness, make seminars, and at the same time provide support for patients and their families.
Professor Suleiman, and the last question, I can't ask it because I am a health technology assessment specialist. What about the reimbursement in UAE? We understand that in your country there are lots of expats, but in terms of your nationals, are all the drugs reimbursed? What is the situation of listing?
So for nationals, yes, the government has created a special insurance coverage for nationals, and yes, all novel therapies are covered through this insurance. Now, for expats, they have, as I will explain maybe in one of the presentations, we have several methods. Private insurance may cover part, but also government support. We have a charity that are really very active for some super expensive treatment like the gene therapies. Sometimes we have like a crowdfunding. So there are several modalities, and we all work together trying to help our patients.
Thank you.
Thank you.